Hello everyone, Mercy here. I am a doctor of nursing practice specialized in mental health. How are you feeling? It's all about your mood with me. I hope you're taking care of your mental health. Whether you're diagnosed, whether you're mentally healthy or not, I hope you're taking care of your mental health. Let's continue our A to Z series. Your B word of choice is bipolar disorder. I am so excited because people are already emailing me their choice of C word. The way we pick is the one that is dominant, the illness that is dominant, the one that you guys pick many times is what we are going to talk about and how it affects our mental health. Keep calling, keep emailing 682-376-6776 or email us mercy at allmercypic.com. Let's focus today on the causes of bipolar disorder, the causes of manic depression, as I like to call it, the causes of what happens that you start experiencing all this intense and severe mood swings, mood shifts, activity levels, and everything is just changing. Let's see what are the causes of that. Now, before I say some of the contributory factors of that, I have to say no one factor has been known to cause bipolar disorder. It is still being researched, and even the contributory factors that I am going to talk about, it doesn't mean that if you have been predisposed with these contributory factors that you have bipolar. No, it just means that with research and with practice, most of the time, people who have been diagnosed with bipolar disorder have been predisposed to all these contributory factors that I want to talk about. And please, if you know someone who is experiencing bipolar symptoms, please advise them or take them for professional help, okay? Thank you in advance. So, genetics play a big role in bipolar disorder. With practice and with research, what we are seeing is that when we diagnose someone with bipolar disorder, they already have a close family member who has similar symptoms like them or who have been diagnosed with bipolar disorder as well. So we can see that some genetic traits are there and it plays a huge component or a contributory factor to bipolar disorder diagnosis or symptoms. Also, we have neurochemical imbalances. You have serotonin, you have norepinephrine, you have dopamine. These are all neurotransmitters in your brain cells. These neurotransmitters help to regulate your mood. Now, when there's a disruption or a compromise or an impairment in these neurotransmitters that help to regulate your mood, then we start seeing a shift in your mood. We start seeing some mood instability to the point that it starts mimicking bipolar characteristics. So yes, those can be contributory factors. Also, we see a lot of drug abuse users, alcohol, drugs abuse, who have been mimicking bipolar symptoms, and we are diagnosing the sign and the symptoms. So we see that substance abuse people in general, tend to behave like bipolar patients, or if they are already having bipolar diagnosis, starting to abuse drugs or using alcohol exacerbate those symptoms as well. And it even makes it, even those who are being treated for bipolar disorder, when they start abusing drugs and alcohol, it makes it very difficult to even manage their symptoms. So yes, we have seen some traits or some characteristics from drug abuse patients. And then we diagnose them with bipolar disorder or we monitor them for bipolar disorder. We also have things like hormonal imbalances. So we talked about neurotransmitters in your brain cells. Now we talk about hormonal imbalances, like your thyroid hormones, your reproductive hormones. Most of the time, these also play with your mood. They influence how you feel. When there is an impairment or a disruption in these hormones, we tend to see differences, shifts in your mood, and we start monitoring for bipolar disorder or not. Some environmental factors have also been known to contribute to bipolar disorder symptoms or signs. People may be going through a lot of traumatic events, through abuse, through very much of stressful events. Things happen, big life changes to the point that their body is stretched one way or the other. Their body does not know how to respond to these changes. And with that, your brain is not able to adjust to these changes. This leads to severe mood swings or mood changes to the point that we start seeing characteristics of bipolar disorder patients. We start seeing those characteristics that mimic signs of bipolar, and we monitor them for that. Again, please, if you have gone through all this, it doesn't mean that you have bipolar disorder, but we are seeing people who have been diagnosed with bipolar disorder being predisposed to all this. Again, advise, bring people to professional help so that we can assess better, we can provide appropriate treatment. There's a lot of research still going on about bipolar disorder. So these are not conclusive, but these are what we are seeing that is trending with bipolar disorder. We'll talk again later about how to manage people who have been diagnosed with bipolar disorder. Thank you so much for watching. See you next time. It is always a pleasure interacting with you guys. Bye-bye for now.